hygiene refers to the activities performed to keep your body clean and therefore maintain health and avoid the spread of disease. Good hygiene is important for maintaining good physical health. Hygiene also helps you to be socially accepted and so contributes to your social health as well. There are a few basic practices of hygiene that are important for every individual to follow. As a teenager going through puberty, certain changes to your body create some extra hygiene needs to focus on as well. Let's take a look at some of the practices necessary to maintaining good hygiene. Washing hands is one of the most important activities to prevent the spread of germs and disease. There are certain times when hand washing is especially important, like before preparing or eating food, after using the toilet or changing a diaper, or after you cough, sneeze, or blow your nose. You should also wash your hands before and after caring for a sick or injured person, and after touching an animal, animal food, or dealing with animal waste. After touching garbage, playing outside, or working out, it is also necessary to wash hands. There are 5 steps to washing hands correctly. First, wet your hands. Second, apply soap and lather by rubbing your hands together. Third, scrub hands for at least 20 seconds. If you hum the happy birthday song twice, that should be about 20 seconds. Be sure to lather the backs of your hands, between fingers, and under fingernails. Fourth, rinse hands with clean running water. And fifth, dry your hands with a clean towel. If soap and water are not available, use an alcohol-based hand sanitizer. But remember that washing hands with soap and water is the best way to reduce the number of germs in most situations. Just as important as frequent hand washing is bathing the rest of your body. Daily baths or showers help to rinse bacteria off your skin and control body odor. If it is not possible to shower every day, use a washcloth and soap to wash some parts of your body, especially your hands, face, armpits, groin, and feet. It is also important to wash your hair frequently enough to avoid a greasy look. Everyone's oil glands function differently, so you will have to pay attention to your body and decide for yourself how often you should wash your hair. Look out for dandruff, or the shedding of the scalp's dead skin cells. Dandruff can be treated with shampoos that are specially formulated to treat itching and flaking. Fingernails and toenails are another important aspect of good hygiene. Keep nails trimmed and be sure to clean under your nails where dirt can gather. Oral hygiene includes brushing your teeth at least twice per day and flossing at least once per day. Brushing should be done with fluoride toothpaste and should take at least 2 minutes. Brushing teeth and flossing fight gum disease, tooth decay, and cavities. Brushing your tongue can help prevent bad breath or halitosis. Visit a dentist every 6 months for a deep cleaning and so they can check for and treat any cavities you might have. Equally as important as keeping your body clean is keeping your clothing and surroundings clean. Good hygiene aims to prevent the spread of germs. In order to accomplish this, not only should your body be clean, but also your clothing and the place where you live. Be sure to wash your clothes if they become dirty, sweaty, or stained during your daily activities. Strive to keep your living space clean and tidy, especially the kitchen where food is prepared, the bathroom where you clean yourself, and your bedroom where you sleep. Keeping these areas clean can help to prevent disease and also make you feel more comfortable. As was mentioned before, when you enter into puberty, changes to your body can create new hygiene issues that must be addressed. Many teens deal with acne, caused by pores that become clogged with oil and dead skin cells. Acne can appear on the face, scalp, neck, chest, back, and arms. Wash your skin gently with warm water and oil-free, non-comedogenic products twice daily. If the problem persists, consider seeking help from a healthcare provider like a dermatologist. In addition to your skin producing more oil during puberty, you also sweat more. When sweat mixes with bacteria on your skin, it results in body odor. Bathing daily can help to prevent body odor by rinsing away sweat and bacteria. Additionally, some people apply antiperspirants or deodorants under their arms to block sweat ducts and combat odor. Areas of the body that tend to be warm, humid, and dark are susceptible to fungal infections. Athlete's foot is a fungal infection that causes a flaky rash between the toes and sometimes the rest of the foot. Keeping your feet clean and dry can help prevent athlete's foot. If you happen to contract athlete's foot from a contaminated shower, locker room, or pool area, a pharmacist can recommend products to cure it. Jock itch is a fungal infection that causes a red, itchy rash in the groin area. To prevent jock itch, both men and women should be sure to dry themselves completely with a clean towel after showering and change underwear frequently. Again, if it becomes an issue, a pharmacist can recommend products to cure jock itch. Puberty also brings more body hair. Some women choose to shave their legs and underarms, while others might opt to wax or bleach unwanted hair. In many countries, women do not remove underarm or leg hair. After puberty, some men begin shaving their faces, while others allow facial hair to grow. Puberty for women marks the beginning of menstruation, the shedding of blood and tissue through the vagina. There is quite a variety of pads and tampons available, and it may take some experimentation to find a brand and absorbency level that works for you. Regardless of your selection, it is important to change your pad or tampon frequently to avoid odor or leaks to your clothing. If you choose to use tampons, there is a slight risk of toxic shock syndrome or TSS, which presents similar symptoms to the flu. It is rare but potentially serious and should be treated by a doctor. The packaging for tampons usually contains information about TSS. Your uterus is a self-cleaning organ, so douches and feminine sprays are unnecessary, although some women still use them. Both douches and sprays could be irritating to your body, so consult your doctor before using them. Hygiene is clearly an important component of your overall health. Not only does good hygiene protect you from illness and the spread of germs, it can also safeguard your social life. Are there any practices we discussed that you could put into action to improve your personal hygiene?